There's so many systems to navigate in every direction.
It's hard to get access to the help you need when you need it.
We need long-term programs that create access for transitional housing that have shorter waiting times.
You try to do the best you can, but then here comes human services system like, if you don't get yourself a house, we're going to take your kid.
Everyone you come in contact with through all this should know about trauma.
We as moms, we want to do the best for our kids. We need that opportunity.
I mean, where do we go from here? Are our voices really going to be heard?
It's stories like these that made it clear to us that as a city, we had to do things dramatically different. Hence, shared safety. Shared safety is Philadelphia's coordinated community response to domestic violence. Women Against Abuse is the co-backbone organization along with the Department of Behavioral Health. This is a collective impact model. A collective impact model means that you have different organizations, that there's a shared problem that nobody can get at on their own. The question is, how can everyone be a part of screening and intervening at a much earlier state?
You know, we for many years were assuming that domestic violence can only be dealt with through policing. Police are certainly a part of it, but every agency within the government, in every entity within the neighborhood, has a responsibility to help with the situation.
For many years, Women Against Abuse has been pushing to get the city to have a locus of authority around relational violence. Now that we have this position, Azucena is working with all city agencies to figure out how to change things permanently.
Shared safety is precisely to bring representatives from the health and human service agencies at the table with the domestic violence agencies and with other social service agencies and figure out precisely how we improve what we already have and we integrate better practices into systems that are already working. And we need to start thinking, you cannot be an effective child welfare worker, you cannot be an effective mental health provider if you don't know about domestic violence. So instead of domestic violence saying, one more thing I need to learn in this training, domestic violence should be part of my professional development.
So the promise of shared safety is that we're moving into a place that actually is more appropriate for a big group of people that we've been missing until now. That we're now moving into behavioral health, we're moving into public health, and we're framing this as something that actually impacts people's health and well-being. I think this has the potential to really be transformative at a big city level.
The elimination of domestic violence is a priority. It affects every segment of our city's life. My hope is that the shared safety plan will maximize our resources, coordinate our efforts, and keep more people safe and keep more people from being abused in the first place.
And in fact, Philadelphia will be the first to achieve it. There's no other precedents like this anywhere. So we're really excited that Philadelphia is in line to have yet another first addressing relational violence.
When we think about big impact, we will be able to identify intimate partner violence early on, so then we don't end up in situations with high lethality, and with that you avoid having more homeless families, trauma on children. There's so many benefits of intervening early instead of waiting until this is a very dangerous situation.
I think it's a long-term goal, but we'd have a much healthier city. Without private donations, we wouldn't be able to do any shared safety, because shared safety is mainly private donations. That's how we do it. We have taken on a lot, we're innovators, and we've taken it on, but it's at some risk because we have to keep raising more and more. And so we need everyone to be a part, and every dollar counts. With the ongoing support of our community, we know that we can have a future free of relational violence.